At South Texas Health System Children's, your child's health is our priority. When they're ill or injured, we're ready to help. Our team includes on-staff pediatric specialists in infectious disease, cardiology, orthopedics, neurology, ear, nose, and throat, and more. Our round-the-clock care features the Valley's first dedicated children's ER. For more than 15 years, we've offered healing and hope for kids. And we're here for your family now. South Texas Health System Children's.
Where kids come first.
Good afternoon and welcome to our latest Let's Talk Children's Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS Children's, thank you for joining us. Now, prioritizing child health is crucial for ensuring that we have a healthy and productive future generation. By addressing issues like proper nutrition, immunizations, physical activity, and mental health, parents can help their children grow up healthy and free of preventable diseases. So to help parents prioritize their children's health, STHS Children's launched these Let's Talk Children's Health webinars last year. Through education and advice on the health issues that affect kids, parents will be better prepared to ensure their children's health and well-being. In this installment, we'll be talking about infant care. Nearly 4 million infants are born in the United States each year. Unfortunately, the infant mortality rate in the U.S. is higher than in other high-income countries, with major discrepancies by race and ethnicity per the CDC. Keeping infants safe and healthy through their first year of life is critical for their overall growth and development, as well as their long-term health. So to talk more about infant care, we're joined by Dr. Omar Peña Lopez, an STHS Clinics pediatrician, hospitalist for STHS Children's as well. Dr. Peña Lopez, thank you so much for joining us.
Thank you for the invitation. I'm glad to be here and share information about taking care of the infant at home and in the family.
Yeah, and we want to give a special shout out to Didi Cantu. She is our program manager for the neonatal program who put our presentation together. Unfortunately, she was sick. So Didi, if you're watching, thank you, and we hope you get well soon. Now, doctor, you deal with children as a pediatric hospitalist every day. You're in our hospitals, you're dealing with hundreds of kids in the course of a week. Do we see a lot of infants coming in with a lot of different health issues that parents are sort of noticing and bringing them to our hospitals?
Of course, it's very common, especially newborns, sometimes to present with a significant problem. Some of them so significant that might need to stay in the hospital.
And what are sort of some of the common things that we find? And of those, are some of them preventable? Maybe there's bacteria due to bottles not being properly cleaned, or do you see some of those issues that with a little bit of education we may be able to prevent hospitalization of those infants?
Yes. For example, sometimes they are admitted because the bilirubin, which causes jaundice, they look yellow, and it's because the breastfeeding is not done the properly well.
Okay.
For example, if the kid is taking, or the mother is taking too long to breastfeed the baby, then it's gonna most likely to have the jaundice, okay? And a way to prevent that is giving proper education about how to do the breastfeeding if there's only doing the breastfeeding, no formula at all, okay?
Yeah, so there is a lot that we can learn. You have a great presentation that Didi put together. Do you want to get started?
Yes. Okay. Okay, the transition to home. So what we're gonna do now, okay? The neonatal period is usually up to the 28 days, and it's very important because a lot of transition is going in the baby, especially the pulmonary function, in the heart, and also getting used to the new environment, getting used to the sleep-awake cycles. And breastfeeding is very important during this time of the neonatal period. Getting home, preparing to get discharged and to be sent home, we usually go to a process that makes sure that the kid is safe. For example, the car seat that the baby fit properly, especially for premature babies, okay? This is very important to make sure that on the way home, the kid is secure, And there's several regulations. Each state is different according to the law of each state. Here in Texas, it's mandatory to have the kids in the seat. You can get a fine if it's not like that, okay? The safest position in a car is in the middle of the back seat, okay? That's the safest position, okay? Of course, sometimes you have multiple kids, so you need to arrange the kid based on the number of kids that you have, but it's always good to have them properly secured in case of an accident, okay? Continue with the prevention. Overall, at home, preventing the infection is very important. Simple measures like hand washing, and they usually help a lot, okay? And since we recently came out of the pandemic last year, we can still do the mask if somebody's coughing at home, if one of the parents is having a cold symptom, or if you have more kids, if any of them is coming sick from school, you may ask them to use a mask, and that way to prevent that the newborn gets sick. Also, be careful with visitation. We recommend that visitation to be limited during the first month, especially if somebody is sick, and that way the baby doesn't get sick because somebody goes and have, let's say, a simple cough, but that in baby can be of significant, especially also if the baby is premature. For example, very common during this time of the winter is the RSV virus, and it could be a simple cough or cold symptom for an adult, but if a premature baby gets it or a newborn, they can get very sick from it. For example, during the newborn period, once the baby is born, the skin-to-skin contact is very important. Starting since the baby is in the hospital, it will help the baby to regulate the temperature, to get more comfortable, and to also to know and to get used to the mom. And it helps also the mother, because the mother is gonna stimulate the production of the hormone that promotes like the milk production. And skin to skin also help with the full sleep and awake cycles, okay? And also helps with the brain development, and it helps to calm the baby. A common question that we get is, okay, what about breastfeeding or bottle, or how am I gonna feed the baby if I have both options? I'm pro breastfeeding, because the breast milk has a lot of advantages compared to the bottle. Exclusively breastfeeding. One of the main benefits of the breast milk is that it's free, and it has all the nutrients that the baby needs. The only thing that may lack is vitamin D, might be a little bit low, and for that reason it's recommended to do vitamin D supplementation in babies that are only taking the breast milk. And it can be done, usually the American Academy of Pediatrics recommends 6 months, but it could be up to 2 years of age or beyond if the parents prefer that way. It's very important, the vitamin D supplementation, especially if you're not doing the formula. What are the breastfeeding benefits? There are several benefits of the breastfeeding, and one of them is that it decreases the incidence of respiratory and abdominal or diarrheal diseases, because through the breast milk, the mother passes on some antibody that help fight disease up to the 6 months of age. And also it reduces like the ear infections, okay? Another that have been linked to the breastfeeding baby is that obesity rate is lower in babies that are exclusively breastfeeding. Also decreases on the long term the childhood cancer, and it protects against allergies. What are the benefits for the mom? It helps to burn some extra calories in the mother. Also, it lowers the episode of bleeding because when the baby is breastfeeding, it stimulates some hormones that helps to contract the uterus and also helps the uterus to go back to the usual size right after birth. And then there are some stages for the breastfeeding for the breast milk. During the first week, it's important to know that this is the time when the passage of antibody is going to be the most from the mother to the baby. And that milk is slightly different from the after 1 week because initially it's more concentrated, but it's very high in antibody. And although might be a little bit less, it's very important that the baby is put to the breast as long as he wants and as frequent as the baby needs, okay? After like 1 week or 10 days, then there's another, what we call the transitional milk. It starts to change in the color, not that yellowish, and then usually after 2 weeks, it start getting more like the regular breast milk. And the production established is more, there's more production, the baby gets satisfied for more because the mother is producing enough. In that stage, it's very important for the mother to have a good balance of eating and also drinking enough water to keep herself hydrated. Also, it's very important the mother gets some rest, and whenever the baby is sleeping, then the mother tries to sleep as well. Alright, when to do the bottle feeding? If you notice that the baby is not sleeping well or is looking for more food and you are not producing enough milk, then you can do some bottle feeding supplementation. One difference is that the formula feeding usually is going to last longer to be digested, so the baby needs, you could take longer time in between feeding. When you do, let's say, 4 ounces of the formula or 2 ounces, it's going to take a little bit longer, so the timing in between feeding might be like 3 to 4 hours. As when you are doing the breastfeeding is different, you must be doing it every 1 to 2 hours. Also, if you notice that the baby is not gaining enough weight, you might need to supplement with the formula, especially during the first weeks of life. Usually, it's allowed the baby to lose at least no more than 10% of the birth weight during the first week of life, and by the second week of life, the baby should be back to the birth weight. Okay, going into the daily care is very important. What are the things that the baby needs to keep the baby healthy? It's very important the bath, okay? And also very important the safe sleep. For example, the baby should sleep alone in the crib on his back. Never do the sleeping with the parents in the bed because accident happens, and it's very common that some parent wants the baby to be with them in the bed because sometimes it's easier to have them by your side, but there is a high risk of suffocation of the baby because you might be tired as waking up different time of the day, not getting enough sleep, and it might lead to death of the baby by suffocation. So if you are very tired, please put the baby on the crib on his back and take your nap or your sleeping, or take turn with your husband or with your spouse. Okay. Infant bathing. Usually it's recommended after the umbilical stump fall to start doing a regular bath of the baby. And there's no specific rule for that, but recommendation at least 2 or 3 times in a week. Some parents prefer every day, and that's fine. Just make sure that the temperature of the water is not too cold for the baby, and that usually helps to keep the baby more more clean and to prevent the overgrowth of bacteria. And of course, that's depending on the tradition of every family. What are the signs of sickness? When to call the doctor? This is something very important. I usually recommend the parents not to fear to call the doctors or to call to the clinic or to any emergency for advice in case there is a concern, or to take the kid to the doctor. The sooner the better, especially if you don't feel that that the baby is not doing well. Okay? Things that are very important, any fever. And don't let the kid stay with fever, especially during the first 30 days, because any fever at that age could be a sign of a significant bacterial infection that could be localized either on the urine, the blood, or the brain. So any fever 100.4 and above, please go to your doctor, talk to your doctor, or go through the emergency. Also, if you notice that the patient, your baby is vomiting a lot, if you see that the baby is not acting as usual in terms of very sleepy or very difficult to wake up, or if you see a severe rash, or if you see any bloody stool or any bloody vomiting, also if you see like the yellowish color, as I mentioned earlier, like jaundice, and if it's very marked, that might be another reason to take the baby to your doctor. Okay, thank you. And then that's all some of the recommendations that usually we go through with the babies in terms of overall care. There are other things that can be done as well. So,
Now you've been working with families for years, and you've been a hospitalist with us for just a little less than a year. But this is all very important education. How important is it for any expectant mothers and families to be learning all of this ahead of time? Because I assume once the baby comes, it's your time is going to be completely different. So you should really be educating yourself as soon as possible, right? Once you know you're pregnant, and especially if it's your first child, reading up and making sure. Is there any education that you recommend that they read? Any books or anything that they should read up on?
yes, there are several options nowadays that with all these social medias, and there is a lot of information available about prenatal care or during the prenatal visit that the mother can that is available to the mother, that she can get some information about how to care of the newborn, especially in new mothers or mothers that have a long time in between their last birth, ¿verdad? Then you need for them to refresh some information, and the advances nowadays are significant that you can get some education through applications or through one of those YouTube channels or Instagram or even Facebook, that you can get information about how to care of the newborn. And it's important to do it before the baby is born, so you could be prepared, have all the things that you might need to take care of the newborn.
But it's important, obviously, to make sure that those are reputable sources, that you're looking at information. It's not just somebody who's putting up information. So I know when I was growing up, it was What to Expect When You're Expecting was the book that I think all moms read. So a book like that, something that's published from a reputable source, would be good information, right, Doc?
Yes, there is one book, is the name is Caring for the Newborn.
Okay.
And it's sponsored by the American Academy of Pediatrics. The book's been there for a long time, and that's one source. Also, of course, CDC website. You can look also American Academy of Pediatrics. They have a website for general caring of the kids. You can just look for that. American Academy of Pediatrics, how to take care of the newborn. That's a good source of information for for the family that you know it's going to be backed by science.
Yes. Now let's talk a little bit about some of the things that you touched on in the presentation. So breast milk, I had no idea that first week that the breast milk has a higher concentration of all of those antibodies, and the color would be different than the milk a week or 2 weeks down the road. When should parents worry about the color of the breast milk after that second week? Are there any telltale signs that you need to worry about the breast milk?
As I mentioned before, that first week is very important to establish the routine for the breastfeeding, and also to make sure that the baby gets the most of what we call the colostrum, as I mentioned, because it's very important, all those antibodies. The color is different, but it's going to eventually lead to the regular color. Of course, if there is new things like blood tinge breast milk, then that's not good at all, okay? Or if there is any sign of infection around the breast, then it needs to be taken care of before continue doing the breastfeeding for the baby.
Now you talked about baby weight and how a baby's weight will drop that after birth, that their weight will drop, but then it'll pick back up. Is there any sort of percentage of birth weight that we should be looking out for in terms of the baby, like over time, like month to month? Would we be seeing a certain percentage that we should be looking out for?
Usually they're allowed to lose around 10%,
okay,
especially during the first week, because while the breastfeeding is being established, the baby might not get enough because the mother is not producing enough. But the best stimulant for production of the breast milk is putting the baby to the breast. And as I mentioned, if you see that the baby it's losing significant amount of weight, more than 10%, then you can supplement with the formula. Of course, we expect the baby by the 2 weeks of age to get the birth weight, the same birth weight when the baby was born, and it's expected like around 4 months of age the baby will double the birth weight. Okay, and usually by 1 year of age is around like 10 kilos. That's like those are kind of the time of the weight that we look.
But obviously, when you're going to your doctor, you're getting your follow-ups, you're doing the checkups, and they'll be able to tell you, oh yes, your baby is doing well, their weight is good, things like that. So obviously, always working with your pediatrician.
Yes, and then usually during the first 6 months of life is when the baby is gonna grow the fastest. Okay, and that's why usually we have more during those first 6 months is when you see the pediatrician more often. That's why you have the 1 week visit, the 2 weeks visit, and then 2 months for the first set of vaccine, followed by the 4 months and 6 months. And besides doing the vaccine, we check on that. How's the baby growing? Is the baby attaining a certain milestone or certain developmental behavior that we expect the baby to, as time passes, that they start developing these activities or things like start babbling by 6 months of age, for example, that you expect that to be done at a certain age.
All right, so always having that relationship with your pediatrician so that you know those milestones and those stepping stones that you should be getting to, that your baby should be getting to. And let's talk a little bit, and you touched on this, and I think we can't stress it enough. Babies have a weaker immune system, right? So that's why cleanliness around the home is so important, as well as hand washing. Anytime that you're going to be caring for your baby, you got to make sure that you're washing your hands, right?
Yes, very important. As we all can remember, we're coming out of the pandemic. Hand washing, it was stressed a lot, and it's the best and most simple thing that we can all do. You can make sure that there's some hand sanitizer, that there's soap and water available, so whoever goes and visits your baby or any family member, even your other kids at home, make sure that, especially coming after school, that they clean their hands, and if they want to touch the baby, to make sure that they keep their hands clean. And of course, if somebody's coughing, that person should be away from the baby until the cough is gone. If one of the parents is sick, using the mask helps to prevent the passage of certain viruses. Okay, and the immune system initially is kind of low. As time passes, it's going to start developing and getting stronger. And that's why, going back to the breastfeeding, it's very important to establish a good breastfeeding because the baby's gonna get those antibodies through the breast milk.
Now let's talk about bathing a baby. You should bathe your baby safely. What is the safest way to be bathing the baby?
The most important thing is never leave your kid or your baby alone when you're taking a bath, or when the baby is taking a bath, sorry. Because sometimes happens that, oh, I'm gonna pick up the phone, and in a matter of seconds the baby can flip, and even newborns, they move, and they can turn around, or they can move in certain way, they can drown. And accident has happened that mother, they go and pick up a phone, and 1 or 2 minutes, and when they go, the kids it's in very bad situation because of that.
So knowing that, is it important for parents to learn CPR, and especially infant CPR, because that is obviously very specialized because of their bodies and their developing bodies at such a young age?
Yes, there are classes that can be learned during the prenatal visit or after as well if needed. And basic CPR always is very important because that can help to save the life of a kid at home.
And then bathing the child, really 2 to 3 times a week should be sufficient, that you really don't have to worry more about that, because I know I bathe daily, so I would assume, I need to bathe my child daily, but 2 to 3 times a week.
That's a minimum, but we know being Hispanic, it's likely it's gonna be every day, multiple times if it's possible. So of course, it's, as I mentioned, it depends on the tradition of your family, but that's the minimum. So you could do it every day if you feel that that's okay with your family.
Now, I am sure there are a lot of tired parents, a lot of tired moms that are watching. There's advice that you should sleep when your baby sleeps, so that way you're basically making sure that you're not too tired to care for your child. What advice do you have for moms and their sleep cycle, and when they should be getting that sleep, and making sure that they either pair off or that they're sleeping when the baby sleeps?
Yes, it's very important to provide the reassurance to the mom that their first priority is the baby and herself. And mom tend to that they need to take care of everything at home. No. Your priority must be the baby and yourself. So if also in the family they can help, like taking care of other things, or other family member help with the laundry, they can help with going to the grocery to pick up food, so that the mother doesn't have to be thinking about those little things and be focusing more on the baby. And also the mom must remember to eat well, drink enough water, and of course, as I mentioned, getting enough sleep, because that way it's not gonna feel overwhelmed by everything that's going around. Sometimes the baby's sleep is off cycle, meaning that they might be awake through the night and sleeping through the day, and then that might throw out of the balance and the family, because the dynamic is different in that term.
And in researching for this presentation, the safe sleep guidelines, obviously following those, making sure you don't sleep in the same bed with your baby, but the baby should sleep in the room with their parent for the first 6 months. Is that right? Just to sort of develop a relationship. And I read that it helps regulate the baby's heartbeat, their immune system, and their stress levels, if they can kind of sleep near their parent.
It's convenient if they sleep, of course, the baby in the crib, as I mentioned, because there have been episode of events of baby dying by suffocation because a parent, very tired, just roll over on top of the baby, and then baby has died because of that. So to prevent that, always put the baby on the crib, on the back. The back to sleep helps to prevent what we call the sudden infant death syndrome. It's that some baby, for unknown reason, die during their sleep, and studies done for a long time have shown that if you put your baby to sleep on his back, it's gonna do better. It's not gonna happen.
All right. And you talked about visitors to the home. So the first month, you should really not have any visitors coming to the house. I know grandparents are eager to see their grandbaby, but really that first month is critical to make sure for the safety of the child.
Yes, it's important to limit the exposure to other disease. You know, a close relative like the grandparents, it's kind of difficult to tell them not to go. The only thing might be, you know, like limit the amount of people maybe at one time that are visiting. If they go, make sure that if anybody's having any cold symptom to stay away, you know, just ask them politely, you know, you're coughing or you're having a fever, you should not see the baby. But basic stuff like hand washing and having some hand sanitizers over there. You could ask them not to kiss the baby in the face, because, you know, we adults can, or any kids can have bacteria. So just simple things like that should help, okay?
Now, when you're dealing with a fussy baby, and we've all heard this, is there any advice? And you are a father of 4, so I'm sure you dealt with some fussy babies in your day. What advice do you have for a parent who is dealing with a fussy child?
Most important thing is to be patient, and also to take turn with the other parent, to make sure that if you do regular things like medication for colics that are over the counter, if it doesn't seem to be helping, just take turn with your other parent. That way you don't get overwhelmed. And if you don't see that, or if there is a sign that there might be something else, please call your doctor or go to the emergency if you don't see that the kid is improving.
Now, we hear a lot about swaddling. Obviously, the baby is swaddled. How important is it to swaddle the baby for their own safety and for their comfort? Does swaddling really help them sort of regulate their sleep and control their crying and things like that?
Yes, swaddling, we recommend, if you're gonna do it like that, better to use a simple piece of the linen, not to be those puffy ones or very thick ones. No, they're just the simple ones, okay? And do it in a way that the baby breathing is not compromised, not too tight, okay? And as I mentioned, it's very important that it's not those thick ones that, you know, the baby.
Yeah, they don't need a wool blanket.
Exactly.
They just need a nice little simple, almost like you see those washcloths that they have. I've seen them in the hospital. They're about the same thickness. They're
Exactly.
pretty thin cotton.
Those one are that's the best example. The one that the hospital provides, that would be the best one, especially for newborn.
Now, there may be people who are taking their child out and about, and we are dealing with cold fronts that happen here and then. How should parents approach dressing their babies, especially since they can't speak and say, "Hey, I'm hot"? What should they be looking out for to make sure that their temperature is regulated and it is comfortable for them?
Yes, especially during the first month, the babies are more sensitive to either very cold temperature or very hot. A rule of thumb would be like, if you feel the room is cold, the baby is colder. Or if you feel the room is hot, the baby it's gonna feel it more. So you try to, if it's too cold, at least 2 layers of covering, and if it's too hot, just simple. The room temperature could be around 75 to 78.
Okay.
And it depends how cold it is outside or how hot it is outside. But a room temperature around that, it will prevent things like, if it's too low the temperature, the baby can get nasal congestion. Usually less than 74, the baby will have some nasal congestion just because it's too cold.
Okay. Now, you talked a little bit about when to worry about your child's health. One of them was the temperature above 100.4. So if they get a temperature above that, and then is it recommended to do the rectal thermometer for the infant? Because normally we're so used to the ear or the mouth, but for babies, I understand a rectal temperature is better?
Yes, correct. The most accurate temperature is the rectal one, okay?
Okay.
But if you're uncomfortable doing that, just use one of those digital thermometer, and you can put it on the armpit or in the mouth.
Okay.
But you're right, the most accurate temperature is usually the rectal one.
All right. And then if the baby isn't eating, that's a sign you should really probably talk to someone, seek some help if your baby just for some reason is not eating anything.
Eating is one of the parameters that also you can use as a sign if there is something going on that is not okay, because when the baby stops eating, it's significant, okay? It needs to be evaluated because that could be a sign of infection as well, okay?
Mm-hmm. And then crying constantly, where it's just uncontrollable and nothing that you do seems to help.
Exactly, the high-pitched crying, unconsolable crying, then you need to pay attention to that, okay? Because in that sense, it might signify that might be something hurting or any inflammation in the baby that or sign of infection as well, okay? So if you see that the baby is very fussy, not consolable, and is refusing to eat at the same time, please take your baby to your pediatrician or call them or go to the nearest emergency.
Mm-hmm. And then obviously paying very close attention to their bodies. So any type of rash that you might notice or something that looks different, maybe the stomach is protruded or whatever it may be. If you notice anything that's different with your baby, you should be paying close attention to that, right?
Yes, some rashes are benign and they go away on its own. But if you notice a rash that is kind of persistent, extending and spreading a lot in the body, not going away, or seems to be there seem to be other signs like very fussy or not eating at the same time with a different rash, then please, that might be another reason for evaluation.
Mm-hmm. And what are the signs of dehydration in a baby that we should be looking out for? Because you had touched on it, but what are the signs specifically for a baby?
For baby, the urine production is the first thing that's gonna see, or you're gonna see a difference on how many diapers the baby is wearing. So if there is a decrease in that, that might be a sign of dehydration, that the baby is not getting enough fluids.
Okay. And then you touched on it a little bit about asking for help. It's okay to ask for help from your family members and loved ones if you need any type of support in terms of you're just not getting enough sleep and you really just need a day or a few hours to just get some rest. It's okay to ask for support, because I know there's a lot of guilty moms out there who think I can do this myself. It's okay to ask for help.
And we live in a society that talks a lot about being independent, but let's remember that when the baby is born, the mother also should be able to reach for help, and that should help to prevent like depression in the mother, because when you try to do a lot of stuff and you don't complete them, that might start affecting your feelings, because you might feel, I cannot keep up with what's going on. But as I mentioned earlier, the most important thing for the mom is to focus on the baby and then on herself. And then if she can have the support from the extended family, that will be very helpful to prevent, to get like burnout because of too many stuff at the same time.
Mm-hmm. And you mentioned this before we started the presentation, that you will get calls that when you are dealing with patients more outpatient in the clinic, that they would call you for anything and everything, and it's okay to call your pediatrician just to if you have a question, not to worry about calling, right?
Yes, it's very important as a pediatrician to make the family comfortable. Some doctors might feel, they're gonna call me for any little thing, and in reality, when you allow them to call you, to be available, it's very important, because you can prevent an emergency visit, okay? But at the same time, you might really uncover something that needs to be taken care of right away, and you might save a life. So keeping that line of communication open is very important, that they feel that they can count with their pediatrician to help in the moments of needs of questions.
Alrighty, thank you so much, Dr. Peña Lopez. We really appreciate your time.
No, thank you for the invitation.
All right, and that officially concludes our webinar. Thank you so much for joining us. We hope you will continue to prioritize the health of your children, and we look forward to seeing you for our next installment of this Let's Talk Children's Health series on Wednesday, March 20th from 5:30 to 6:30 p.m. when we talk about poison prevention. Like and follow the STHS Children's Facebook page for more details on our future Let's Talk Children's Health webinars. And to view all our previous Let's Talk webinars, simply visit sthsletstalk.com. Until our next seminar, stay healthy, stay safe, and please continue to prioritize your health and the health of your little ones. At South Texas Health System Children's, your child's health is our priority. When they're ill or injured, we're ready to help. Our team includes on-staff pediatric specialists in infectious disease, cardiology, orthopedics, neurology, ear, nose, and throat, and more. Our round-the-clock care features the Valley's first dedicated children's ER. For more than 15 years, we've offered healing and hope for kids. And we're here for your family now. South Texas Health System Children's,
Where kids come first.